away. So it then just inspired me to get more involved with it, because I'm like, this was my story. I was told, this was just anxiety or it was in my head. And the symptoms were just unexplainable. And I started just working with patients with it. And there's definitely an overlap between that, autoimmunity. That's why they call it the great imitator, and is also mental health. I think that's how I started getting into more of the mental health aspect too, because a lot of our patients too, which I know we're going to talk about today, have mental health issues related to the tick-borne infections as well. The most common initial symptoms are, sometimes you can have a high fever, fatigue, really significant fatigue. Joint pain is the other common symptom. And some people will get neurological symptoms. So I've had patients that got, after a tick bite, they got Bell's palsy, which is like the paralysis of the face. So what they'll often do if that happens, they go to the hospital, they might test like the cerebral spinal fluid for Lyme disease itself. But typically the most common symptoms are joint pain. One of the common symptoms for Lyme is you'll have like migratory joint pain, which is actually helpful because when you look at like rheumatoid arthritis, it tends to stay in specific places. Whereas with Lyme, you'll see it rotate because of the spirochetes. Fatigue, headaches are another common symptoms, as well like fever, like I said, is a tip off. So those are kind of the most common ones. And then testing, they're usually going to do, ideally, hopefully they're going to be testing at least for the Western blot. But initially they typically will do an ELISA test when they're testing.
Yeah. And some of those tests then like 56% can be negative, right?
Exactly. So, but it's more likely to be false negative than positive. Yeah. So that's why you definitely, is a suspicion and you're negative. Technically, per CDC, Lyme disease is a clinical diagnosis. So it shouldn't be made purely decision on the laboratory work. It should also be matched with clinical symptoms. So, and one of the issues is the fact that many people will be false negative, and women even more so. And then when you look at infections, most people have autoimmune conditions, have one or two chronic persistent infections. So all of my patients with, let's say, rheumatoid arthritis or lupus or any autoimmune condition, I'm always testing for other viruses and bacteria to see, because sometimes when I actually work on, let's say, Lyme disease that they had and they had rheumatoid arthritis, I'll see their rheumatoid arthritis symptoms get better, or I'll see the rheumatoid factor, their serological, their blood tests improve when I handle Lyme disease.
Today we're going to dive into a powerful and often misunderstood topic, Lyme's disease. Over the years, there has been a significant increase, with reported more than 500,000 new cases of Lyme's disease annually, which is substantially higher than the annual cases for diseases like HIV or AIDS. And unfortunately, this tick-borne illness receives less than 0.2% of the public funding allocated for HIV, for example. It is very common for the patients with Lyme's disease to be misdiagnosed, undiagnosed, or simply dismissed by healthcare providers, forcing these patients to commonly see multiple providers, from 5 to 7 on average, until they get a proper diagnosis and treatment, and sometimes at much later stages of their disease.